Hello, I'm Dr. Stephen Karp, board certified plastic surgeon. On this video, I'll be discussing important information for women considering breast augmentation with breast implants. To begin with, there are two important things all patients need to understand before you proceed. First, the endpoint is not a number, letter, or cup size, but has to do with the visual result that you're looking for. And I'm going to go over that a little bit further on. Secondly, your breasts are not symmetrical. Nobody has perfectly identical breasts before or afterwards. And understanding this is critical to having realistic expectations of your final result. As it relates to the implants themselves, there are two basic types of implants: saline filled or silicone gel filled. Both implants have a silicone shell. The difference is what the implant is filled with. The most common implant used today is the silicone gel filled implant. These implants have the characteristics of being softer than saline and can have less rippling or palpability than saline. Some refer to them as gummy bears. The other implant is the saline or saltwater filled implant. Remember, all implants have a silicone shell. The difference is what it's filled with. For patients under the age of 22, saline is the only implant that's approved by the FDA unless there are certain pre-existing criteria that a patient meets. Next, and perhaps the most important decision, is what size or volume in cc's of the implant. As I stated earlier, this is based on a visual result that you're trying to achieve. So I try to avoid talking about breast size by cup, such as A, B, C, D, as there's no standardization in the garment industry for what that means. Therefore, to help both the patient and myself understand the desired result, I offer 3D imaging. This allows a simulation of the body with use of different implant sizes so that you can get an understanding visually of what that might look like. From there, I can make a recommendation of a specific volume in cc's. Cup size just does not have a lot of meaning. As an example, this is the same patient wearing bras from different manufacturers with cup sizes ranging from B to double D. Two additional decisions have to be made as well: the incision location and how the implant will be positioned as it relates to the pectoralis muscle. There are three general incision locations. The most common is the incision under the crease of the breast, followed by an incision partly around the areola, and finally an underarm incision. The incision I typically use is the crease incision under the breast. The second decision is how the implant is going to be placed as it relates to the muscle. The implant can sit completely on top of the muscle or partially under the muscle. Partially under the muscle is the most common approach, and that's typically what I use as well. Now, let's talk about the surgery itself. Your procedure is performed as an outpatient in our surgical suite. You'll have your surgery and go home the same day. About 3 to 5 days later, you'll have your first postoperative appointment. Plan for the first week very light, limited activity. After that, you're back doing most of your normal light things. In 7 to 10 days, you'll be feeling comfortable and getting close to proceeding to your full activity level. However, we'll wait about 3 weeks and from there slowly progress. All surgery, of course, has risks. General risks, which include infection and bleeding, both of which are extremely uncommon with breast surgery. There are specific risks for breast surgery and breast implants. No implantable device, which not only includes breast implants, but also devices such as pacemakers, artificial hips, etc., is considered permanent by the FDA, meaning that at some point the implant could fail and have to be replaced. For breast implants, specifically silicone gel-filled implants, that's roughly about 3% per year. What's important to note is if the implant did fail and rupture, there's no evidence of a health risk to you. The longer you have your implants, of course, the odds might catch up to you, and at some point in the future, you may have to replace one or both implants. Are there any long-term limitations after having breast implant surgery? Well, I don't place any restrictions on patients once you're fully healed. You still need routine monthly self-breast examinations and mammograms when the time comes in order to do routine breast screening. There are other important details patients need to be aware of as well. Your body is naturally going to form what is called a capsule around the implant. It's there in every patient. We expect it and it's supposed to be there. However, in a small percentage of women, that capsule can shrink or what we call contract around the implant, and this can make the breast feel firm or even progress to become hard or painful or even cause distortion of the breast. Fortunately, it's not common and may only occur in one breast. There's nothing you or I can do long term to prevent it from happening, and as I said, fortunately, it's not common. Once the implants are placed, there's nothing that actually holds or anchors that implant in position on your chest. Therefore, it's important that patients wear good support long-term with well-fitting bras. If they are placed below the pectoralis muscle, as you tighten or contract and use that muscle, you might see movement in the inner portion of the breast, and it's what we call animation. That varies in how noticeable it is in each patient, and most patients do not have any issue or concerns once they're healed and they're aware pre-surgery that this could happen. You would typically be able to feel the implant, feel some rippling, or even the edge of the shell of the implant. The thinner you are, the more likely that's the case. Silicone gel-filled implants are usually softer and will usually have less rippling, especially compared to saline implants. There's no evidence that breast implants cause any general health problems or breast cancer itself. If you did develop breast cancer, the fact that you have had breast implants should not affect your prognosis. As I stated previously, you will still need routine breast screening mammograms and self-breast examinations. When you have a mammogram, you'll need to let them know that you have implants if they haven't asked you already, so they can do special views to help separate the breast tissue from the implant. The implant can block some of the breast from being visualized. However, there's no evidence that this has any effect on prognosis if you did develop breast cancer. If your implant deflates and you have saline breast implants, it is usually obvious by the breast size decreasing fairly rapidly. In some cases, it does happen more slowly. The saline that's leaking out is absorbed, and there's no evidence of any health risk associated with that. Silicone gel implants are a bit different. The gel will just sit there if the implant fails and may go undetected. In fact, only about 25% of the time will a patient notice a change, or on examination will it be detected that there's something wrong with the implant. The remainder would require special testing such as an MRI or even surgical exploration to evaluate the implant. The FDA does have recommendations regarding MRIs following breast implant placement. One final issue to discuss is a very rare lymphoma, referred to as ALCL, that has been found in an extremely small number of women who had breast implants placed. Nearly all of these cases have occurred in an implant that's no longer on the market. The most common presentation, if a patient did develop ALCL, is a sudden change in breast size with dramatic increase in that size, and there may also be associated tenderness. If that did occur, you should seek medical attention immediately. Prior to your surgery, you will complete a checklist required by the FDA so that you can confirm and understand all the things that discussed here. I want to thank you for taking time to review this video. If you have any further questions, please ask. And I want to thank you for letting us be part of your journey.